Hello everybody, a very warm welcome to MediStudy Go, a platform that's designed to help you guys in every way possible. Now, today we have three beautiful women here who have actually given their all for the most difficult post graduation that you could ever imagine. Um, Dr. Shiny is doing it now, so I'm sure she'll be able to help us with real insights, things that you cannot actually say openly up there on Instagram. And she has a beautiful page where she shares her journey. I think it would be great if you can go follow all of them. They're not just oral surgeons, they're also content creators, and they help everybody actually feel positive about this entire field, right? So I would like a quick introduction. If you could just introduce yourself in 3 to 4 sentences and help the audience understand, um, you know, exactly what you would like to share today. We'll start with Dr. Devyani.
Thank you, Dr. Pallak. So, good afternoon, everyone. I'm really happy to see so many people still joining in. So, I hope we have a very fruitful session for all of you. I'm Dr. Devyani Beher, and I've completed my post graduation in maxillofacial surgery. And so, after my post graduation, I was working as a research fellow with Cleft Children International for Zurich. And during that, I gained a lot of insight on actually how research helps us. So I'll be able to guide you more for that. I've also been associated with the hair transplant and cosmetology units. So yes, I've been associated with hair transplant and cosmetology units also. So I have my specialization in that as well. So looking forward to for your questions, a one-on-one interaction more than we would be happy to answer for all of you. That's it from my side. Thank you, Dr. Pallak, again for inviting me today.
Thank you. Thank you so much for joining us. And I'm sure that, we will enjoy what you have to say and share your real experiences. Yes. Dr. Neha, would you like to go next?
Yeah. Hi, everyone. Thank you, Palak, for inviting me here. So I'm Dr. Neha, and I'm from Hyderabad. I did my undergrad as well as my postgrad from Hyderabad. So I finished my postgrad, and then I applied for an exam, which is a fellowship exam. There was an entrance exam, and I got a rank, and then there was an interview, and now I'm in Pune. So I'm doing my fellowship in clinical OMFS, which is full spectrum maxillofacial surgery. And basically, I'm working with a senior surgeon who's got like a very 40 years of experience. So we cover his minor cases as well as his major cases. So I'll talk more about it, but as of now, I'm experiencing the out of college maxillofacial surgery experience with somebody who's done it for a very long time. So I'll be able to help you with that about fellowships and how it is, what maxillofacial surgery is once you're done with your college. So I'll be able to help you with that.
Yeah, that's really interesting. I'm very excited. Okay, over to you, Dr. Shahini. And guys, she's one of the most important people here because she's going to tell you guys what happens in post graduation, something that everybody will immediately experience. And what she can add value to is by actually telling you the real insights, what not to do, what mistakes she made. Yeah. Yeah.
Thank you so much, Palak, for having me here. So, hello everyone. I'm Dr. Shahini, a first year OMFS postgraduate at Government Dental College, Pondicherry. So, firstly, I'm truly honored to be one among such, like the panelists among such, esteemed panelists. So, I'm truly excited for all the questions that you guys will have and to share real insights on how post graduation life it really is as someone who's currently in training. So, yeah.
Yes, absolutely. So before we waste more time, we are going to actually go and dive into all the questions. So, okay, I'm going to actually take the position of all the students who are here and actually ask you questions that are related to your time when you were in this phase of your life. Okay. So I think as a final year student, everybody really enjoys oral surgery, right? Because it's something very interesting. It's what you imagine a doctor to be. It's all of what you see in TV shows. So what is it that initially drew you to oral surgery, and how is it different from other dental specialties?
So for me, during my undergrad, I liked all the subjects equally initially, but when I came to my oral surgery posting, obviously it was much more thrilling because in your undergrad, all you're doing is removing teeth, but still, that the moment the tooth is out, right, and the moment you're able to, give that relief to a patient, I think that I did not really get in the other departments. So that adrenaline was always there for me with oral surgery. And what made me take postgrad in OMFS is the complexity of it and how challenging it was, because it entails a much larger real estate to be
Mhm.
very honest, like the entire face. And if you're going deeper into it with reconstruction and everything, and then you're taking a bone from the leg, a bone from the hand, so it's much more complex, much more challenging. And I think I wanted to do something bigger. um, I did like dentistry as well. So second option was ortho probably, but oral surgery was something that I could not let go. So yeah, that was my take on it.
Yeah.
Yeah, so as for me, up until my final year, I liked oral surgery and ortho equally. I think I was not sure what would be the one that I really end up liking, but fortunately, in my UG college, which was in SRM, during our internship, we had night duties, that is the casualty duties, along with our postgraduates, and we also got to enter the OT and see how the entire environment is and how they're working. So that really intrigued me, and I felt like I entered into a whole new realm of dentistry that was much beyond what dentistry was until final year. So I felt like that was like Dr. Neha just said, the entire complexity of it and all the different aspects of it really drew me in. So I think during internship was the time I knew that this is something that I knew I would never get tired of doing.
Mm.
So yeah.
Yeah, that's an interesting perspective. You need that kind of passion.
I would just like to add something small because both of them have covered the thing. For me, surgery was something, which is not restricted only to teeth, as, with other specialities. So in the undergrad, like in final year, I have done my undergraduation from Manipal College. So when we entered the OT, you see the face being treated, you see the scalp being opened, and I've seen ear reconstruction also during my undergraduation. So, all this is something which is encompassed only by one specialty in dental surgery, and that is maxillofacial surgery. So, that word itself, surgery, being a surgeon, is what it drives you to follow it. And that is the passion. I think all of these students who are attending the webinar today have joined us for this very same reason, because you are being driven to that subject. Being a surgeon is the utmost pleasure I can say that I have got in my life. Nothing can be compared to that.
That's absolutely amazing. I mean, I'm actually amazed to see the kind of passion all of you have here, and what you can impart to all of us. So, Dr. Shiny, if you could walk us through a typical, day in your life as a first year oral postgraduate student.
So I think a typical day usually begins by around 6 a.m., wherein I try to squeeze in any quick revisions or any read upon anything that I could have read the previous day. Then we head for our morning routine ward rounds by around 7:30 or 8, and we head to our OPD where we're exposed to a variety of cases, right from simple extractions to all the complex surgical cases and all the special cases being referred to us. And the official day basically ends by 4, but we tend to stay back much later for our ward rounds and all, and also for the casualty calls and such. So it ends up being a tightly packed day, but at the end of it, it feels like all the exhaustion is worth it for the amount of exposure and the learning that we do get. So yeah, in short, that is a day.
Great. And how intense is it compared to BDS? Because that's what we are all exposed to.
So I think from BDS to MDS in oral surgery, it feels like entering into totally different world, because I think probably in B days we were studying for giving exams, giving like getting marks. We were probably the focus would have probably been more on strengthening the foundation, and we could have touched upon basic concepts. But right now it feels like whatever we learn is something that we would be treating the next day. Whatever we learn is something that we are constantly exposed to in terms of patient care. So that factor itself seems like something that is very intense, and you have to be very careful and always learning. So
Yeah. The approach is very different now.
yeah, entirely.
Okay. So, there's a lot of theoretical knowledge also that you have to grasp with the practical knowledge. So, how do you sort of, balance these things?
Honestly, I'm not sure if I've still found the right balance between that, but I try to. So at the end of an exhausting day, you just want to get back to your bed and get some good sleep. But you know that I try my best to squeeze in some study sessions here and there whenever I find little pockets of time. Like if some case intrigued me, or if I was asked a question in ward rounds that I didn't know the answer to, I make sure to write it down in a small notebook, which I always carry in my pocket, so that when I do find the time, I go to the library or get back to my room and at least slightly brush up on that, so that I'm much better equipped to deal with the patients the next day. So I'm still figuring out the right balance, but I'm trying.
Dr. Neha, Dr. Devyani, would you like to give her tips?
I
Yeah,
think I want
please.
to add something to what Shahini just mentioned about the little notebook. That notebook was literally my holy grail, because every time, like, so whenever we used to go near the faculty, right, to mention anything or to talk about a case, and then they would tell us things to read about or go and check that author's article, or, if we had to tell them that we're preparing for a case. So they tell you a list of things that you have to prepare for that particular case. If we did not have a notebook, they would actually get pissed. So it's actually a two thing. It serves our purpose also and the faculty's purpose also. So the faculty is like, I'm saying something, why are they not noting it down? And the second thing is, we will not forget either. And if they're mentioning a particular author or a book, it's always better to write it down, right? Or a small, there are these clinical tips that are never mentioned in textbooks, which only these faculty will suddenly drop out of the blue, and it's your duty to write them down and put a star around it. So this notebook is going to be extremely helpful. Always, always, always keep a notebook in your scrub pocket.
She's absolutely right. But I just have a small funny incident to share that, we all have these notebooks. So we were all called, one of our faculties would constantly tell us things and we would note it down. One fine day, he just called us out of the blue. All the pages went, and without listening to him, they started opening the notebook and noting it down. And he's like, "You what? You're news reporters. I've just called you to tell that you have to go for lunch." So this is something. But yes, apart from this, the notebook is very, very important. I mean, that one small notebook holds much more information than any single textbook can have. I would say that.
So nice. Okay, let's collect all our notebooks and pass it on.
But you have to make sure that you go back and read it. It should not be lying within, because only when you read it, you will remember things which are being told. If you read some textbook randomly, you're not going to grasp that much of information. When you're being asked something, you go and search back for it. That is when you tend to remember things.
Yeah. Absolutely.
Totally agree.
So all of us should make a notebook right now and write all the points that you guys are saying. Okay. Let's talk a little bit about the patient load in each of the colleges you've done your post-graduation in. Dr. Neha, would you like to tell which college it is? What was the patient load like?
I did my postgrad from Mallaradi in Hyderabad. So I had not applied for All India counseling because I had to stay in Hyderabad. So based on my rank, I was able to get a seat in Mallaradi. And over there, we had a good flow of minor cases. So when I say minor cases, I mean all the cases that you can do under local anesthesia. So impactions, which is our third molar surgeries, implants, and minor cases like facial small lesions on the face, or fibromas, intraoral fibromas, or even extraoral lipomas or something. Even small sinus surgeries and everything we used to do. Those were the kind of local anesthesia surgeries we used to do. And coming to major, we had a good exposure in fractures. Because we had a medical college and a hospital also attached. So whatever casualty cases were there, we used to get those cases to operate, the trauma cases, road traffic accident cases. And we also had a lot of cysts and tumors, which are benign. Okay, and coming to cancer, oral oncology, we had to go to another center, a regional cancer center, because in our campus, we had a cancer research center, but that was operated by the medical oncologist. So for our particular oral oncology, we had to go to a separate regional. That's a posting anyway. That's a sort of a compulsory posting anyway that you have to go to, unless your college has a full blown oral oncology unit. And apart from that, cleft also we had to go to a separate posting. Cleft and craniofacial surgeries, that also was in Hyderabad. So that is the kind of exposure we had. We did not have much in orthognathic. That is one thing that I probably feel that I should have got more exposure. But that is going to be with every college. Like a lot of my peers from other cities and all do complain that some of them don't get trauma, or some of them don't get. Every college has their limitations. One thing you have to understand, that you will not get to see the entire textbook in your PG in OMFS. So yeah.
Yeah, that's great.
That's absolutely right, Dr. Neha. So I have done my MDS from A.B. Shetty Institute of Dental Sciences. So that is ranked as, one of the top 10. It comes in one of the top 10 colleges. So we had an associated cleft center as well. So from my perspective, I've had huge exposure to cleft patients, and we would do the prenasal alveolar molding. So if you are not able to understand the terminologies for those students here, we would deal with babies as small as 2 days old, and you have to hold them, you have to take their impression and try to reduce the gap between the cleft. And during the same craniofacial postings, we have seen a lot of cases of all the syndromic cases. I've seen craniofacial dysostosis. We've seen so many patients with Treacher Collins syndrome being operated. So yes, I did get a lot of exposure because of the craniofacial and cleft center, which was attached to our dental unit. And same happened with the orthognathic. We have not done, but yes, we have observed a lot of orthognathic cases as well. And regarding the oncology postings, we would have one set of oncology postings in our medical college, that is KS Hegre Medical College. And like Dr. Neha said, the others are peripheral compulsory postings, for which we went to Regional Cancer Center in Trivandrum. So after this, we would also get exposed to neurosurgical postings, which were good for about 3 months. So we have been I know I've opened the scalp, I've opened the brain, and you've done so many things in and out. And regarding the minor cases, yes, we had a lot of exposure. It was freehand. You could do anything and everything, doing arch bars, trauma cases, and wiring techniques, anything and everything you can imagine, because each PG would get 1 full month of complete casualty posting. So that means that PG, whatever cases are coming to the casualty in that month, are just for that PG. And it's like Dr. Neha said, that every college has their own limitations. That is absolutely correct. So maybe a college may have a lot of patients, a lot of cases would be coming, but it may be possible the staff may not give you so much of free hand. There are colleges in which the staff is ready to give you free hand, but you do not have that much variety of cases. From my perspective, I would say a student, if he or she is willing to learn, can learn even with 10 cases. And if he or she is not willing to learn, will not learn even with 100 cases. So it is completely on your, will your determination. Sometimes you need to poke the faculty. Faculties will poke you with the questions. Go poke them back with your answers, with your doubts, because that is when they will be, able to understand that you are very much interested in the field and you want to, take it up very seriously. Exposure is limited. That will be a drawback for some colleges, but then try to learn whatever you can in one or two cases, or whatever maximum you can grasp from everything. Try to learn from basic OPD patients which are coming. Try to observe. You go to ward rounds, you should be able to see not only your patients, just try to have a look how your peers in the medical department or surgical department, how what cases are they handling. So you get exposed to, but I'm sure all the dental colleges have an attached medical hospital, so you do have ward rounds. And when you go to the wards, I think that is the best place where you're exposed to a lot of cases, and you can learn so much just by seeing. So oral surgery is, even that for that matter, any subject is not merely going through textbooks, reading the theory. You need to be practically involved, and you should keep your eyes open, I would say.
Great perspective. Absolutely, amazing. I think this was very insightful because you need to understand that it finally depends on you. I think you brought up that point really well. Dr. Shiny, would you like to add something?
I almost forgot that I had to speak next. I was so imbibed in taking in all the tips from Dr. Devyani and Neha. So yeah, regarding patient load, I think so. I'm doing my post graduation from Government Dental College in Pondicherry. So here, as like in many government colleges, the patient flow is really good. But so as a first year, we currently get hands-on only with simple extractions, transalveolar extractions, third molar surgeries, my basic minor oral surgical procedures like alveoloplasty and such, and also the pre-workup for trauma cases like arch bar, eyelids, and all of those wiring things. So as of now, we're more like we're more involved in assisting our seniors and faculties with all the variety of surgeries that they do, and I think we learn more from observing right now, so that we can better equip ourselves for when we get to that stage where we can operate. So in our college, I think there's a really good flow with respect to trauma and all the minor oral surgical procedures and orthognathic as well. But there's almost like in these few months that I've been here, I've not seen even one cleft case. I think that's just been operated. I think maybe like a couple of cases. I think we have a peripheral postings in JIPMER in second year. So I'm hoping to grasp all the information and knowledge from there as of now. So yeah, my exposure right now is limited as a first year, but I'm hoping to have as much knowledge as Dr. Neha and Devyani when I reach their stage. So yeah.
Great, great, great. Absolutely. So, looking back, Dr. Neha, which year was the most difficult year as a postgraduate in oral surgery?
I think first and third year were relatively difficult. Second year was, I wouldn't say a breeze, but second year was a bit relaxed, because first year you're just getting into the whole feel of it. It's very difficult to understand what faculty, senior, junior, so much to do, right? First year. And the third year, obviously, you're stressed about your exams, all your submissions, all your files, and your thesis submission, and everything. Second year was sort of easier compared to first and third year. And second year was when I actually started my page also, and I started documenting my entire PG journey and everything. I was able to record content and edit videos and everything. But yeah, first and third year were difficult.
Yeah. So, Dr. Devyani, what looking back again, what would you tell your PG self about surviving those 3 years?
So, when you enter this specialty, when I entered, I was very overwhelmed with the whole environment, I think. You are not used to dealing with so many patients. Suddenly, you're seeing so many cases around, and you have to read so much. You have to go back, prepare for your seminars, you have to prepare for your thesis synopsis. Everything around you is just very overwhelming, and you have lack of sleep. You're very low on sleep also. So there were times when, you feel ki, why are we sacrificing so much? But then that one patient you treat, especially for me, when I would go for the ward rounds, and even if you are just assisting a senior surgeon, but in the during your PG, you are the one who is checking on the patients, you're doing the ward rounds, and you're taking their history and everything. So you are more connected to the patients in that sense. So when that one patient also comes back and says, thank you, doctor, then it's just worth it. It's worth that whole grind of 3 years, because there is nothing beautiful than a patient. And I have personally treated, like I said, I've treated cleft babies. So I have seen a baby from 10-day old. He had his mother still messages me because I have seen the transformation in him with the appliance I have given. So for me, there was nothing can be compared to that whole feeling. So what I would tell myself is that yes, you are made to do this. That is why you are in this field. Don't ever doubt yourself. You are chosen for this field. Not everybody can be a maxillofacial surgeon. That is what I believe. It takes real hard work, real guts, and real determination to enter the specialty. Because you have to be strong. The grind is going to come from everywhere. And if you are strong, you're going to sail through very easily. There are moments you will feel low. There are moments you just feel like, everything is just not working out. But then you have to remind yourself that there is a reason you have chosen this field and you need to just move on. That's all I would tell.
Really nice. Um, so I think the common thread that binds us all here are two things. One, as Dr. Neha mentioned, content creation. I think each one of us here found ourselves through content creation. And the other aspect is navigating oral surgery as a female. So let's talk about these two topics now. So, I'm sure that you might have faced any gender specific challenges, especially in a branch which is so demanding. So, if you would like to share any of the experiences, what you learned, and how you could combat that, would be great. Anybody, this is open to all. Okay.
Dr. Devyani, do you want to go?
Okay, I thought maybe you were speaking, like I just tell. So, yes, Dr. Pallak, this is absolutely correct. This not only maxillofacial surgery, I would say all surgical fields are predominantly, it's a male predominant field. That is, they would think, but actually it's not. You see the ratio of female PG students in any colleges. They are more in number. They're always more in number. We always outnumber the guys, but somehow that concept of, that a man is better in a surgery, that has been prevalent since so many decades, and it will take time for it to change. But we have so many eminent female oral surgeons in our country itself. We have Dr. Sonal Anshila, like she's the HOD of Government Dental College, Ahmedabad. Okay, and so she is pioneering so many different surgeries. She is one of the a few surgeons who operated on so many mucormycosis cases during the COVID. So when you look back to female surgeons like her, that gives you that determination and spirit that, oh, this bias is actually nothing about. Like you said, yes. In my batch, so we were 8 PGs inducted, and out of that, initially, I was the only girl in the male batch. So all of them were males. I was the only girl. Also, I'm short-heighted. I am little slim. So that it gave them the perspective that Acha, she's like, what do you say? She's very fragile, timid, like that. Things come up. Okay, and that's how I remember one of my female staff has remarked also, guys, you need to be little, you need to be little gentle with her. That is a remark which is coming from a female staff. Okay, maybe she meant it in some other way, but that was one point where I felt, ki, why is this field so looked upon, like, only males can predominate and be. And when you, my senior batches, my junior batches, they had only 2 males and 6 females. So, like I said, the predominance of female PGs in dental colleges and maxillofacial surgeries is always there. All right. So, but then eventually, you have to make your place, because we come, being a female, I would not say we come with a lot of shortcomings, but we have certain things which may hamper, like, if you are on your, you have your monthly cycle. Now, how many of your male colleagues would understand that, or would reciprocate that? Okay, we can switch the ward duties with you. That okay, we can stand in the OT for you. So you need to be really strong on that aspect. You need to make yourself, you should be strong, as hard and as strong as a rock, that nothing can break you. Because a lot of criticism comes, and not only from your peers, I would say it comes from the patients as well. I have seen a lot of patients calling my junior PGs, female PGs, as sister or nurses. Because that is the mindset. If it's a female, she's a sister or nurse only. So they don't think of you as a doctor until you tell them, or you be very bold and very authoritative in front of them. So I would say it is how you depict yourself. If you think that being a female, you are weak, you are, you can get away by saying that, Acha, I'm not able to do or something, just for the sake of not doing. If you genuinely have a problem, consult with your batchmates and, work a solution out. But if you think, if you portray yourself as the weaker section of the PG group, then definitely everyone is going to, look at you that way only. If you have some hurdles or something, try to overcome those and rise against everything. And then, you need to come out. You need to make a lot of effort. I would say it takes more effort for the female PGs to come out to their male counterparts. I have maybe experienced that way, and I have seen that way. But in the end, you should also know that since you are a batch, the batchmates will always stick by you no matter what. Maybe there are one or two instances, but do not think that you're weaker than anybody. You need to hold your ground very strong. And I would say again the same thing, that please look up to the female oral surgeons which this country has. So when you look at them, no, you really feel like, oh my God, this is what we can also do. And it's not like now the trends are changing. The trends are definitely changing. It was initially that only males predominate the field. Now, even if you see in orthopedics, it's one of the specialties on the medical side which has a male predominance. But now I'm seeing so many female orthopedicians who are coming up. I see so many content creators that way. They are posting their journey and everything. So the trends change. Everything is changing. Just you need to be very strong on this perspective, that it doesn't matter if you're a male or a female, because it doesn't have to do anything with your physical strength. Somebody, once told me, "Aap to female ho, how will you take out a teeth?" Because it's not with your physical strength. It's about the technique. Oral surgery is about technique. It's a technique oriented subject. It's not a test of your physical capacity at all. So please remember that always. If Dr. Neha would like to add something.
Yeah, so I firstly want to add, it might come as a shock to you guys, but my college was a women's college. Okay. So every PG in my college was a female. The only males we had in our department were the faculty. So we had like 3 male faculty and the remaining were female faculty. So coming to whether there was a discrimination between female and males, that was not there in my college per se, because it was a women's college. But I would not deny that there was this whole thing where sometimes, from your peers, you hear these things. Oh, you're a woman. How will you do it? You have to get married. You have to have kids. So sometimes I feel like more than the patients, it comes from your peers, from your parallel batch at different colleges, or from your seniors. Like suppose my undergrad friends or my undergrad seniors who I meet in conferences, or I meet outside, or I message them for something, they are more discouraging than even your patients. Patients, they just want a treatment, especially when you're in a college. In a college, you're going to get patients who want to get their treatments done for a little, lower cost, and they don't have much knowledge. In colleges, mostly you get a lot of rural side of patients also more than your, private patients you see are very different. But in a college setup, patients do not have that much of an issue. At least I have not faced it, maybe because it was a women's college and the patients were aware that this is a women's college. But yes, this sister thing has happened a lot of times. Like the patients, they would see us in scrubs and they think that anybody who's in scrubs is a sister. So first I would say sister Kadu. Like in Telugu, they were, I was not sister. I'm a doctor. I am also a surgeon. I would first always make sure, like Dr. Devyani said, you have to be authoritative because you're a female. You are indirectly, the first thing that comes to their mind that you're the weaker sex. That's how it's been for generations and eons. They think that you're the weaker sex. So you have to be authoritative from the get go. You have to show that you are a surgeon, you are a doctor. Otherwise, they will never take you seriously. Even if you show a hint of doubt on your face, they will be like, Sir ko bulao, call your sir or call your senior. So you have to show, even if you don't know what you're talking about sometimes, just go and, talk to somebody, get your knowledge or get your doubts cleared, but don't show it to your patient. This is something that I've always told my juniors also. Like when I was in third year, my second years and first years, I've always told them, don't let the patient know that you're in doubt. And I've seen this happen a lot of times when I'm doing the surgery and if somebody's assisting me, especially in local anesthesia. General anesthesia patient does not know. But in local anesthesia, when you're doing a case and your assistant sometimes make these sounds, oh shit. These sounds that your juniors make, they instill doubt in your patient. And even if the patient is okay, even if the patient has no problem, he will still think that psychologically and he will come back with some kind of pain or some kind of complaint. I'm having numbness, I'm having pain, it didn't go well, your senior should have done it, sir ko bolo karne ke liye, or something like that. So that is one thing that I've always had this thinking. You establish your place, your stand, your authority in front of your patient, only then the patient will be confident about you. So that's one thing. And another thing is about the whole, our monthly cycles and all of that. Sometimes they're understanding about it, your faculty, your seniors and all, and your batchmates. Sometimes they're not understanding. Sometimes they're on the lookout, okay, oh, she's not doing well, so I'm going to grab her case. So that's also going to happen. It's not always rosy with everybody. This is the reality. Sometimes, because at the end of the day, everybody is your competition. Your batchmates, your seniors, your juniors, they are your competition. That is the bitter truth of the world. So, like Dr. Devyani said, you have to be strong. You have to take care of your health. And yeah. And another truth is that you will have to take breaks. You will have to take breaks for your pregnancy. Not everybody is able to work through the 9 months. There are some really strong women who are able to work all 9 months and then they take a very short maternity break or whatever. But some people are not able to do it physically, health wise. So you have to understand that. And you have to accept that truth that if you are going to be a woman surgeon, you will have 1 or 2 years of gap. But it is again on you how you pick up, how you quickly come back. You have to make your comeback. Because even I have seen that there are more number of PG female students. But if you go to a conference, you will see more men. You will see more men surgeons who are actually practicing. PG mein to there is like 80%, 70% women.
Correct.
But conference mein jaoge, it's all men. So the conversion rate is very low. So it is upon us to get the conversion rate high.
Dr. Neha, that's because she precisely pointed out the fact that you have to take breaks in your career. And I think I am an example. Dr. Palak already knows. My baby is just 1 year old. So I'm on a break for the last 1.5 years since my pregnancy. So
Wait, I'll clarify. This is not a break because she has been working all this while.
That's what I meant to say. But then I found something to keep myself engaged with, and also which helps me to build my knowledge more. And that is how I found MediStudy Go. Because being a part of this platform gave me such a good exposure and it made me go back to my books again. I think Dr. Neha would agree to that. When you were taking the session for the NEET, I had to go back to my basic books to read and, to formulate things. So yes, breaks will come. Neha is absolutely right. The breaks will come, but you have to bounce back. You cannot sit by thinking, ki, acha, 1 year has happened, 2 years has happened, abhi now what will I do? Let's just sit at home. We tend to get comfortable. You ask me, I've become so
Yes.
comfortable at my home. Like, I have my baby with me. I just have to cook food. I have to take, but somewhere at the back of my mind, honestly, I'm telling it to you. And I think my husband is also listening, but this is an honest fact that at night, when at 1 o'clock, I'm thinking that what am I doing with my life? Somewhere I feel ki no, I was made to be a surgeon. I have taken that field. I need to bounce back once my baby is old enough to, that he will stay in a daycare or something. I need to bounce back and I need to go for what I was meant to be. I've taken this field not just for the sake of as a jewelry in front of my name ki I'm an MDS OMFS. It needs me to do something. It needs sacrifices. It needs your attention. It will take a lot of your time also, but you have to bounce back, because if you are not, I think then you will not do justice to the field. If you have that passion, you have to come back. And whoever females are listening to us, that please don't get demotivated when we say that the discrimination or comparison is there. It is there. It is there even in a family between a brother and sister. He's more stronger, the sister is weaker. So those things are going to be there. Just don't be bothered. Don't listen to it and move on with your work. That's how the world is. The world is rough so that it makes you strong, and you have to stand against it.
Beautiful. This is like almost converting into a motivational session, but
Yeah.
let's look at the positives. Um,
Yes.
is there anything that I would say makes us stronger that we are a woman? Like, maybe like the emotional side of it, that we are able to actually hold up a patient much better when he's low, or anything that would actually give us that one plus against the strength. And
Definitely. I think we have soft power. Women have soft
True.
power. And I think patients are more comfortable, or they don't hold back. With women, they're able to tell their actual troubles. Like when you go to the ward also, and we check up on a patient. Because with men, I think they hold back a little bit. In front of men, they don't want to tell exactly what they're going through, their pain and everything. But with women, no, we have that soft power and they're just able to tell you. So we're able to connect better with the patients and even the patient's family. I think we tend to always establish a connection. Women always establish a connection with patients and their family. Men don't really always do that. They're like, Kaam kiya, chalo. They're very like practical and very, so yeah, that's one difference I definitely see. And also when it comes to the PG part, I think Dr. Shahini will also understand this if she has male colleagues. In your PG, when you're doing your filing work, when you're doing your seminar presentations and everything, I think we are better in these things. The way we present our seminars, case presentations, JCs, the way we portray ourselves, even in conferences, and if there's a program in college, we have that. We are better organizers and we're better. I mean, I'm not trying to put the men down or anything, but inherently we are better organizers and we just present things well. So that's one thing. Yeah. That's very helpful in teaching as a woman.
100%.
So as for me, I have like both my colleagues as in the first reviews, they're guys. So in like when we go meet our patients during ward rounds or anything, for some reason, I think the patients automatically assume that they are the authoritative position and I'm like their subordinate or something, like I'm inferior to them. But one thing I've noticed is even though patients maybe subconsciously it's like ingrained in their brain that they put the men on the pedestal, but once we start talking to them and like depending on the way like our patient care, it gets tuned in their mind that this person is actually, they like Dr. Neha just said, they tend to open up to us even though initially they may have seen the other person as the superior. As they see how we approach the patients, how we deal with all the different cases, they tend to open up to us much better. And I think we have the empathetic side in us at a much higher level than our male counterparts. So yeah.
Absolutely. Thank you. Thank you so much. This was very, very insightful.
This was a lot.
Yeah. So guys, I think we need to like send hearts to them. We are getting too boring right now. Yeah.
Maybe we
Uh,
should ask the students to ask some questions
yes,
there,
yes.
like, so that they're out of that trap.
So,
Yeah,
maybe I hope everyone is listening to us.
Yes, please put in your
100%.
questions in the chat box or come on video, come and talk to us.
Yeah, 100%. You
Love to
wouldn't get
hear
this
from
Questions
opportunity.
directly. They can just raise the hand and we take the questions directly, I guess.
Yeah,
We have
you.
a question.
yeah. Dr.
Select.
Isa has asked, while selecting a college for our masters, what all should we consider?
Okay. So, firstly, if you're okay with geographically, if you're okay with any place, then that's amazing. And first thing you should consider is that there should be a medical college attached for sure. Most of them do have it, but very few colleges do not have. I have seen those also. So, medical college attached, good patient flow. And among the faculty also, if you have faculty who are sort of doing diverse kind of cases, that is always good because you will learn, you will get to experience all kinds of subspecialties. MaxFax has around 8 to 9 subspecialties also. So if the faculty are well trained and everything, that will be give you a very good exposure. And what else do you want to add? Anything, Dr. Devyani? I'm not able to recollect very quickly right now.
Pretty much the same that, medical college attachment. And
Good OPD.
I have a feeling somehow that you should always don't try to, I feel that I should have done this. Don't try to take colleges which take 8 to 10 PGs because then the work gets distributed that way. Try to go for colleges which have max 3 to 4 PGs so that you get a lot of exposure. Because even if you have so many patients coming, getting divided between 8 to 10 PGs is, you'll get merely some patients to do. So I would say look out for colleges, see the seats. You can always see what is the college intake. So look out for those colleges and if you have some uh, financial constraints as well, then maybe have a balance by seeing that the college is paying you good stipend as well, and also the fee is a little on the lower side. So, few colleges in Bhubaneswar, or I think yeah, there are colleges like that. So the stipend is good enough, and the fee is also high. So it less. Sorry. So it balances it out. So if you have something of those sorts, so these are 4 to 5 points. I think that's it.
Yeah. Okay.
If I may add, I think one more thing we should, like before joining any college, we should try to talk to the PGs who are currently pursuing there and try to see, like, there could be a variety of cases that come in, but we may not be getting hands-on training. Like the faculty may be taking up most of the cases, we may not get as much hands-on training in certain colleges when I heard. So I think that is also something we should see, like the kind of cases, and we should try to get first-hand information from the PGs who are currently pursuing there. So,
See, what Dr. Shahini said is perfectly correct, the hands-on aspect. But that is one thing that I see a lot of people sort of have this, like, they're stressed about it. Hands-on nahi milega, hands-on nahi milega. But I'll tell you something, the trends always change. Like your previous batch maybe would not have got hands-on due to whatever reason. But like Dr. Devyani mentioned in the beginning of the call itself, that you have to poke. For me, like, because I used to perform well or because I used to answer questions, the faculty also felt confident enough to give me a little bit of hands on. It is upon you how much confidence you instill in your faculty about you. First, you show your theoretical knowledge. When you're presenting a case, first you show that you know things. Only then they will give you hands on. Every batch does not get it, and you might be the first student who's got a hands on. It is not that एक कॉलेज में अगर इतने साल नहीं मिला है तो आगे भी नहीं मिलेगा. That's not the case.
Absolutely.
You have to poke and you have to request your faculty. Sir, can I please do this part of? Sir, can I please give the incision? Sir, can I do the closure? Sir, I'll do the suturing. You have to, repeatedly ask. You will get humiliated sometimes. What do you know? We'll not give you. You don't even know how to answer questions. So next time you will go read and come and answer the question before asking. But you will get a chance. So that is one thing about the hands-on that I wanted to add. Yeah.
Great. Okay, next question is by Dr. Nimisha. Ma'am, many dentists I have referred to for which branch I should take have told me that female OMFS don't get consultation much. They have to open their own practice to work. Yeah, I think she wants your views on these aspects.
I think the view is pretty much the same, that, you have to. Why females? Because, like we said, they tend to take a break. So, again, when it comes from transitioning from the PG life to getting into the consultant practice, not a lot of female oral surgeons are there in the market. So, when that happens, obviously the ratio drops down. And what happens? Another thing is you get married. So, you would probably want to open a setup which is your personal. So you can monitor your home also, you can monitor your child also. So that is another aspect of it. But amongst my friends and all, I have seen my one of my friend in Mumbai, and she's getting consultations like in and out, and she has to travel a lot. And it's so happened with me also. Till the time before my marriage, I was getting consultations good enough. So it's not like they have to that's it's not a compulsion. They have to open their own practice. They open the practice because of to suit their own needs, right? So it's never
Logistically.
like that. Yeah, you will get consultations. It is never like that. So again, it comes to the point that you need to be authoritative. Same thing when you are going to a clinic to get your consultation, give your reference card, and you say that yes, I've done so many, I have this experience. Be authoritative. When they know, eventually they will call you. It so happened with me in Chennai itself that I did not get consultations initially, but later on, they did start calling me. So, whatever barriers you think are coming, it's not because of the people around, it's because you may have some personal barriers, your marriage, your kids, and something of those sorts. So, you need to balance things out and maybe look out for a solution which helps you in that way.
I think it depends on how much you put yourself out there, how much you go and meet the person. And there's also a few things that a lot of people forget. They think that if you are a PG, if you have that, that credential, people will not give you a case. You also have to be disciplined. You have to show up on time. You have to not do too many cancellations. These are the reasons that even after you give your name in a particular clinic, they're not calling you again, probably because their previous experience with another woman or with you itself was not great, in the way that maybe you didn't show up on time, maybe the patient had a complaint, or maybe there are certain things, you have to soft these are soft skills. Hard skills are what you learned in your college and came. You know how to do an extraction. I know, even the male, we know it equally. But why are they calling the man over the woman? It's because he's showing up. He's showing up on time. He's showing up even a little later in the night. See, women also have these barriers where they say, oh, it's too late in the night, I'm not going to come. It's too late, I can't come alone. My family is not allowing, my husband is not allowing. These are the kind of reasons, like Dr. Devyani mentioned, these are our own barriers. Once you get out of these, and really it helps if you have a supportive family. If the family is supportive, and if they're coming, if they're scared to send you out in the night, ask them to come with you and wait outside. So you show up. No, how much you show up, that much you will be called for consultations. And yes, a lot of dentists will discourage you. I myself was told by probably 10 people, don't take OMFS, females के लिए OMFS नहीं है. Don't listen to them. If you are passionate, it is directly proportional to how much effort and how much you show up. You put in effort, you will get your consultations. That's it. But it will take time. It will take time. You have to build your name. Women have to work twice as hard as men. Men, they'll go 4 times, they will be called next 8 times. Women have to go 8 times to be called the next 9th time, right? So I think that's something Dr. Devyani will agree. We have to work twice as hard.
Yeah, great perspective though. Okay, does private seat is worth for PG, or should I rewrite NEET for a free seat, ma'am?
So I am somebody who did it from a private college, and again, it is worth it, yes, but there is a financial aspect also to it. Can you afford it? Can you and your family afford it is also a question. If they are saying that, we're happy to do this for you, you will recover it. Yes, it will take time. One thing is, it will take time for men and women. I'm going to say this, OMFS mein time lagega. Okay. And loan, yeah, private college ka fees, everything, these are high, I agree. But if you can afford it, then okay. Because there are a lot of people, my friends have paid 16 lakhs per annum in a deemed college. That comes up to 48 lakhs for 3 years. So it's not like, is it worth it? for them it was worth it. They loved OMFS so much. And in a deemed college, the experience is next level. It is a mind-blowing experience. It is worth it. So you have to ask yourself, is it worth it for me? Am I going to make use of the amount that I'm going to put in a deemed college or in a private college? If you're sure that after you finish your PG, you will put in that much effort and make your place, then it is definitely worth it. If you want to just take a credential out of your PG, then don't spend so much money, right? Yeah, that's my view on this.
Yeah.
It
Isha,
would,
I hope that answers your question also. Is it worth taking a loan for MDS? Will I be able to recover, or especially with OMFS since the learning curve is a little longer? I think she answered your question. Nimisha is asking, ma'am, many people told me that you just get a degree in whichever college, then you can learn anything you want by doing a fellowship. Is it true?
I think Dr. Neha will answer that better. I just want to say one small thing. Again, like she said, you just don't need a degree for the sake of getting a degree. Your degree forms the basis, it forms your anatomical basis, your surgical basis to get into the fellowship as well. The fellowship programs have entrance exams, which is based on your practical and theoretical knowledge. So
yes.
I would not suggest that, you just get a degree in whichever college. You may enter any college which is not so well known. That's okay. As long as you have patience, as long as you have exposure, you are learning, that's absolutely fine. But just for the sake of getting a degree, we'll go and do a fellowship and become experts, it is not going to happen that way. It's a learning curve. You need to start from the first year of your PG. And even after fellowship, you still keep learning. It's not like you're going to just emerge out as a big consultant after your fellowship. That is not going to happen. I'm sure Dr. Neha will elaborate more on this.
I agree. So a lot of times I have seen even myself been a little worried, like because there are some students who have done it from really esteemed colleges. Okay, jahan par they have even cleft, they have orthodontic, they have oncology, they have everything. They have all hands-on, every experience. And then you start to compare yourself, ki, oh my God, did I not get enough of it? That's always going to happen because in those esteemed colleges, there are only limited seats. So the other colleges where there are less patients or where there is less experience, वहां पे भी तो students जाएंगे ना. So it's not like everybody gets to do it from a great college. Some people are going to do it from mediocre colleges also. But the perspective I got from very, very senior surgeons, so I attend a lot of conferences. That is, I make it a point to attend almost every conference. And I speak to senior surgeons to get their perspective. And that is one thing they've told me, that MDS is just the start. Don't think that MDS kar liya to you're going to become a surgeon. That is never going to happen because firstly, you will not do all the surgeries yourself. Your major surgeries will be done by your consultants and by your seniors. You will be assisting, and at the most, you will give an incision or your suturing. And if you have crazy patient inflow, you will put a few plates, right? So MDS is your first step in OMFS. After that, which path you take, like if you take trauma, there you go and super specialize. And then if you take onco, you super specialize there. But MDS, you will not learn everything. But also don't discount what MDS is going to teach you. MDS is your foundation. How to do how to follow sterilization protocol, how a suture is placed, how an incision, the basic principles, right? You have to grasp them in MDS. Otherwise, in fellowship, when you go for an interview, you will not be taken in. You think that MDS I'll do off and then fellowship I'll go learn. Nahin. The fellowship directors will not take somebody who does not have the foundation strong. So that is definitely there. Yes, I agree. Some colleges are not very great, but if you're really passionate about OMFS and if you're not able to take another year to take NEET, then go ahead, take it. But put your effort and be really strong in theory. Somebody told me this, ki there are students who get so many cases that they're not able to focus on theory. But there are some people, some colleges who have less OPD and less patient flow. In those colleges, it is a duty of the student to get very good theory knowledge so that their options after the PG increase. Because theory exam is also important in a fellowship exam. So agar theory is strong, you still have a good chance of getting a fellowship, right? तो नहीं है पेशेंस अपने कॉलेज में तो ठीक है कोई बात नहीं, स्टडी वेल, गेट योर थ्योरी do publications. Publications help a lot. Do presentations in conferences, and go for these short courses. There are a lot of short courses which are very cheap, like 1,000, 3,000 bucks ke courses, hands-on courses, 3-day courses where they do teach on cadavers and everything. It is again on your interest how much you branch out. And if your college is having limitations, you can try to learn from 10,000 different places. Again, it's on you. So it's okay if your college is not good enough. So that's my perspective. It was a little long answer, but yes.
Yeah. But needed, right, guys? Just put
Yeah.
thumbs up if you think this is helpful.
I hope you're understanding everything, and the doubts are being cleared, I hope.
Yeah, 100%.
Dr. Palak, 2 questions. We've skipped 2 questions. Can we go back to them? From
Which one?
Radhika and Tanya. Tanya asks that after oral surgery, we can go into anesthesia or TMJ specialty on maxillofacial surgery. So, yeah, she wants to know, Dr. Neha, that please elaborate on what opportunities are there after oral surgery.
Okay, so this is something that I have covered a few times also on my page, but here let me break it down for you. There are some people after max fax who are unable to go into the broader aspect of it. What I mean is go into major surgery. One is because of lack of exposure, second is because of lack of experience, and third is because they're unable to get advanced training. So what they end up doing is they do practice the minor surgical part of max fax, and they also do a bit of general surgery, general dentistry. It's not wrong. It's your choice, right? So you can put up a clinic, you can practice minor oral surgery, minor max fax, and you can do general dentistry if it's your choice. If you ask me, I don't want to practice general dentistry because I am more into max fax. So for me, the path that I would think is ideal is if you want to put up a clinic, go ahead, put up a clinic, but also do consultations outside. Work with senior surgeons, assist them for a couple of years. Maybe you can tie up with 2-3 surgeons and assist them in their cases, and also get a very good idea about how it works in hospitals, how to partner with hospitals because you need an anesthesia team. One thing is MaxFac is not a single person job. It is not a solo hero. It is a team. It's a team effort. You need assistance. You need anesthesia team. Sometimes you even need general physicians, plastic surgeons. So that is one thing that you have to have a good relationship with your allied medical specialties, especially anesthesia, general physicians, because these are the ones who will give you the green signal to go ahead with the surgery, right? So put up a clinic, do consultations, assist senior surgeons, and that's how you will make your practice successful. You cannot just do one thing. In oral surgery, you have to branch out a lot. If you do only clinic-based thing, then you will be, I'm sorry to say, you will be only into minor oral surgery. But if you want to be able to do major surgeries, then you will have to go to hospitals, tell them that I'm a MaxFac surgeon, this is my experience, give them an interview, show them your CV, and get recommendation letters, and then you will be able to do surgeries in their hospital. Probably if they have a casualty, if they have a fracture case, which is facial trauma, they will give you a call. If they have any lacerations, they will give you a call, and then you will be able to go in. Again, like I already mentioned in the previous answer, it is how much you show up. It is how much you show your interest that you want to do all of these cases, then these people will definitely give you a call. And also very important point, have a good relationship with your endodontist, your orthodontist, your prosthodontist, especially the ones who have a clinic, because these are the ones who will give you your cases. Your other PGs, your other department PGs are the ones who will give you cases even in your PG and after PG. During PG, these are the ones who will call you in from ortho department ki, "Arey, do this extraction and give me." Arey, so an endo person will be like, "There is a cyst, can you do this?" So have a good relationship with your other peers. And after PG, people who have clinics, an endodontist who puts up a clinic will call you for all his extractions. He will call you for patients who have a cyst. Many of the cysts are detected by chance. Patient does not know he has a cyst. By chance, X-ray liya aur pata chal gaya there is a cyst. Your endodontist, your prosthodontist, your orthodontist, these are the people who will give you a call. So have a good relationship with them, and that's how your scope will increase. Apart from that, you always have fellowships. Fellowships are for advanced training. You have fellowship in oncology, you have fellowship in orthognatics, you have fellowship in trauma, you have fellowship in cleft and craniofacial. It is how much you want to specialize and go deeper and deeper and deeper. The more you go deeper, the more your scope will always increase, right? And apart from that, you can always join a college. You can become a faculty. You can, you learn by teaching. They always say you learn more by teaching, because when you're teaching, you will not be able to teach something random. You will go back to your books and you will read again. So you can be a teacher, you can go to a college, you can teach as well as operate in a college, right? So that's another very good opportunity. And apart from that, there's always research. You can always do research, you can do PhD, you can go into clinical studies and all of that. But I don't think a lot of people are interested in that. But yeah, this is what I think you should do. Clinic, consultations, corporate hospitals, join a college, do fellowships. And you can do multiple fellowships, not just one. People do oncology and cleft and trauma, and then, they take their path. And now we also have hair transplant and aesthetics, surgical aesthetics, your rhinoplasty, blepharoplasty, lobuloplasty, bat ear deformities, and lip size reduction, many things, not just your Botox and fillers, which are, on social media. There are also surgical aesthetics, which are more our thing than the dermats. Yeah, that is the career prospects that you have after OMFS.
Thank you so much. This was really insightful. I can see Dr. Shiny making notes. But Nimisha has said that, thank you so much for this session. And it literally made me be a passionate oral surgeon. I want to add something here. A lot of you guys said that, this discussion should be about which college will I get, what marks should I have. We really thought about this. We wanted somebody from the counseling segment to discuss it. But truly, all of us here believe that it's really not about the rank, the marks, or anything. Because, Dr. Devyani, has anybody asked you, like, what was your rank? That's a very old question, right? So, although you are in a state where you feel that this is like a make or break for my career, here the people sitting here are a testament to tell you that it's a lot more about persistence, passion, showing up than just your current score, your current rank. So, since you're in this phase of your life, I'd just like to tell you that this entire series that we are curating is to first bring out that passion in the subject, and then you figure out your college, your rank, your marks, you want to repeat, not repeat, all of the other aspects. So, thank you so much for bringing out that passion, because it really helps anybody who is navigating on this difficult 3-month journey of selecting a branch. Okay. Can you please tell us about the fee structures in your respective colleges? Great question.
Okay, Dr. Devyani, were you going to answer? Sorry.
You please start. No, please.
Okay, so for me, my rank was 3,000, and I got a seat. I think it was B category. I don't know. It's in different states, it's called different things. So I don't know what it is in probably your state, but I got in B category, which is also merit. I had to pay 5 lakhs per annum, so it came up to 15 lakhs. Yeah. So
I think now
sorry, I just want to add that I had no reservation. So even though my rank was 3,000 and my batchmate's rank was 4,000, she had to pay only 3 lakhs per annum because she had a reservation. So that is sometimes very frustrating for a lot of people, but that's how it is. So yeah, 4,000, 3 lakhs she had to pay. I'm 3,000, I had to pay 5 lakhs, but that's how it is. So that's something that you'll have to bear. I'm sorry to say. Yeah.
Dr. Shahini, I think she has not spoken for a very long time. We'll ask her to speak now.
Thank you. So the fee structure in my college, it's this GDC Pondicherry. So here we pay 50K per annum, and we get a stipend of 37, 40, and 43 for each year. So yeah.
Wow. What do you do with that kind of money?
It's all covered.
I think again, like everyone, I'm seeing the comments, people are still getting into, that which college is better and the fee structure. And Dr. Neha has told it very specifically. We have covered it that there is nothing to judge a good or a bad college because, like she said, the previous batches may not be getting a lot of hands-on, and they may start it from the present batch. So you just, I wouldn't say that you go blindly into a college. Just have a talk with the seniors and on overall make a judgment what is important for you. Like she gave you the criteria, that geographical location, if you're able to afford the private college fee. If you're not, then go for the next round of NEET and maybe get into a government college. But I would again like to say that taking the drop year is itself a very big task. So if you're mentally prepared for it to take the drop year and then, be very passionate about getting a government seat, it's well and good. But, you have to be very clear about it that you are just doing it not out of any pressure, but you're doing it for yourself that you need to get into a government college. And uh, my fee structure for my college, it was 10 lakhs per annum, and I'm sure it has increased because I've done it 5 years back, so 4 years back. So it would have increased by now. And apart from the fee structure, I think we have thesis submission fees. We have a lot of other expenditures also which we have to cover. You have to pay for your exam fees. So a lot of it comes and it totals up. So before you come on to the thing that if a college is good or bad, try to narrow down your colleges, narrow down 10 colleges based on your location or whatever. Look at the fee structure, discuss it at your home, and then maybe out of those 3 or 5, you can, because in the counseling option, you will have to put. I went through an all India counseling and I was ranking somewhere in 4,000. So I went from all India counseling and I went into AB Shetty. That was my first choice for the first round and I got it immediately. And every year the ranks do not remain the same. Intake of ranks is not the same on for your all India counseling. It depends a lot on the state counseling also because a lot of people who would get into the state counseling would drop out from the all India counseling. So if you think that your rank is pretty bad, it has come in 10,000s, 11,000s, there is no chance of getting oral surgery, do not be disheartened at all. You will definitely get it because the rankings keep changing, and a lot of people who drop out in the state counseling, then the ranks go up for the all India counseling by the second round or the third round, which is there. So mock round, which they say it. So do not worry about that. And yes, that's pretty much about it.
Yeah, thank you. Um, so we also have a question that, as an OMFS, will we ever even feel like practicing general dentistry? Do we? I doubt, right?
Yeah. There are some people who are still passionate about dentistry, so they do go on to continue because they like to treat a patient's mouth
Mouth.
holistically.
Yeah.
The entire mouth, not just the tooth that has to be extracted or not just that little cyst that has to be removed. They want to treat the entire mouth. Like, for example, there are some certain teeth that have to be removed. There are certain crowns that have to be placed. The curve of teeth is not right. So they want to do a full mouth rehabilitation. Especially this comes with people who have a clinic, right? So they want to treat the patient as a whole. They don't want that patient to just come to them for the oral, for the surgical part and then go to another dentist and to get the other treatment done. So there are some people. I think as surgeons we tend to start having this kind of ego ki, oh no, I'm not going to do dentistry, and everything that happens, it's very normal and very common among surgeons. But there are still people who still like dentistry because that was their first passion. Treating
That
the
is your
smile.
bread and butter, actually.
Yes, they say
Dentistry
that.
is
They
your
say that.
bread
I
and
want to treat the entire smile, not just
yeah.
So yeah,
That happens also. If you're married to a dentist, then probably your husband is an endodontist or something. Eventually, you have a clinic, you end up doing the procedures yourself. So it is not a bad thing to be well versed in the general dentistry procedures also, but do not just, start going into that line. But if you have some constraints, you want to be in your clinic only, you cannot go for consultations. So you have that option. Keep that option open for yourself.
yeah,
So
yeah.
it's not bad to have options open for, anything.
But as a
Correct.
PG, you cannot be thinking like a dentist. That is one tip I'm
Yeah.
going to give you. As a PG, don't think like a dentist, because as a PG, you're supposed to think of the entire body. You're more of a medical professional in MaxVax PG than a dentist, because you're supposed to be noting down every medical comorbidity that the patient has. And these are going to play a huge role in major surgeries. If you have skipped that a patient is on any medication, and if your faculty finds out that you missed it in your clinical history, you're going to not see the light of the day. So think like a doctor in OMFS PG. After PG, if you want to do dentistry, that's another thing. But in PG, you have to take the entire body into consideration, his entire history, his previous surgeries, his drug allergies, his thyroid, his BP, his diabetes, everything. So yeah,
Very important. I think that perspective shift takes time, but yeah.
definitely. It's a huge shift. From just the mouth to the entire body, it's a huge shift.
And then again to the mouth. So,
Yes.
okay. What would be the order of good colleges between SRM, Meenakshi, and Shri Balaji? Guys, I don't think this is the right platform to answer this. We will have a session for colleges for ranks. That's for another time. Today, just bring out the passion for oral surgery. Um, okay. What is the on-ground reality of earning potential after MDS in oral surgery?
Okay, so I have seen some of my peers who are doing really well because they have sort of established their name in their respective areas in terms of implants. One thing is, as soon as you finish your PG, a good source of money is from your minor surgery and from implants, because it is something that you can master in a fairly shorter amount of time than probably a fracture or a cyst and tumor or a cancer surgery. Minor surgery is something, if you master it early, especially implants, you have a good earning potential, because implants um, go on the higher side. Implants are expensive. So that is something that, but again, you have to instill confidence in your patient, and only then he will pay you lakhs and lakhs of money for a full mouth rehabilitation with implants. So that is the reality. Again, how you put yourself and how successful your cases are, word of mouth helps a lot. If your patients are giving good testimonials and if they're referring their relatives, it's always a good way to make money.
Yeah, finally, I think the ground reality is that it depends on you. It also, so, one thing that I'll clarify after meeting so many dentists is also that, yes, your college, your degree, your post graduation will matter. But as Dr. Neha emphasized, a lot of your interpersonal relationships, a lot of your soft skills, the skills that are basically not taught in any college, which are basically either self taught or taught maybe through a forum like this, is way more valuable than just your hard skills. So even if you are just a great dentist, your hard skills are great, but you do not have these soft skills, I think it gets nullified somewhere. And, it will take years for you to realize that that was actually the reason that, XYZ, you're not getting maybe good cases or good referrals or stuff like that. So I think one important tip or a takeaway would be that yes, you enroll in a PG, you focus on a degree, but you also focus on other aspects which are most often neglected by your peers, by your, you know, OPGs or things that a faculty member cannot teach you.
Yes.
I'm sure Dr. Shahini is experiencing it, so maybe if she would like to add something.
No, I think that's what I don't really have anything much to add to that. You covered it in whole. So yeah.
Palak, we can't hear you suddenly.
We should consider in our state only.
Sorry, can you please repeat? I think
Yeah.
your connection was off for a bit.
It's constantly discharging, but yes. Dr. Ishita is asking, taking a college in other states, is there like a language barrier? Will that be a problem? Or should we consider taking a college in our state only?
Okay, so I am working in Pune right now, and most of the patients who come in are Marathi speaking, right? and I know Hindi or Telugu and English, obviously. So I know it sometimes becomes a barrier, but sometimes it's also very endearing. Some patients sometimes really find it cute and endearing, and they find it very exotic that somebody different has come in from a different state. So sort of, it's how you use it, sort of. Go to the patient and be like, oh, I don't know the language. Can you please, or just get your sister with you. Make your sister stand next to you, and sort of don't make it your weakness, make it your shield. Get your sister and she will translate for you, and it's fine. You can manage. I have friends who have come from different cities and they've worked in Chennai mein people, so much Tamil, and they many people don't know English or Hindi also. It's like in Maharashtra, at least where I'm working in Pune, people at least know Hindi. So I can be like, Marathi nahi aata, please Hindi mein boliye. But in states like the further south you go, a lot of people don't know Hindi. So it may seem like a barrier, but like I said, try to find a way
Make it
out, get way around it. Don't use it as an excuse. Yeah.
That's right. But she's absolutely right. So I know only Hindi and English, and I went to Karnataka. So I've done my BDS and my MDS from Bangalore only. So initially during BDS, it was okay, ho gaya, kaam chal gaya, you have done it because you don't. But from my perspective, what I have learned is ki since I would have few Tulu speaking or Kannada speaking batchmates, patients would be more comfortable getting treated by them. So that's when it occurred to me that no, if I have to build a rapport with my patient, I have to learn the language. And I learned Kannada, full nahi, but broken here and there. Ki, what's your name? And do you have toothache? What is the problem? Basic. And since we used to have a cleft center, I had to learn Malayalam also. So if you learn here and there, it's not bad. You are adding a language for yourself.
Yes.
Also, it helps the patients to understand that you are more connected to them. Because that is one point where I felt that, they kept going to my Kannada batchmate only. Usko Kannada, even if they know Hindi na, if they see that other person is speaking that language, so they will immediately go to that person. So why not we make an effort to at least learn some basic words here and there, so that you can communicate that, like if you have to ask pain, no won't, pain ho raha hai aapko, whatever, just ask in basic things. उनको उससे they also understand that you are trying to make an effort to be a part of that place.
Yes, exactly.
That's what I have experienced in Karnataka, especially. And like she said, Chennai, I had a lot of issues initially when we got transferred and we came to Chennai, and I was point blank told on my face that we will not get treated by a North Indian doctor. So, when you listen to that and they tell you that you have a good CV, but the patients will not get treated by you, somewhere down it hurts you that, for me, that time I did feel, ki, oh my God. So then I learned a little bit of Tamil also, and I started to get, at least communicate with the patients and, have a rapport with them. That is my perspective on this because I've been in both the places, three of them, Kerala, Karnataka, and Chennai. So yes, they do expect you to speak a little bit.
Yeah, learning a new language actually adds to your intelligence also. So, and I've also been learning Marathi, and it's easier. That does make your job easier. And to be very honest, some of your batchmates and your sisters are also helpful sometimes. So, yeah, why not? Slowly you will pick it up. I think first year is a little difficult, but slowly you pick up the main words. Like in our field, the words are very common. Like there are some words that are fixed, like especially your chief complaint and your pain related words, pain, blood, tooth, jaw, muscle. These are certain words which are repetitive. So just pick them up, write them in your diary, that diary that we were talking about, write those words in the diary. And yeah, it will make your communication easier.
Yeah. Isha is asking, is there any scope for going abroad after OMFS?
So abroad, maybe you can go for a fellowship. But if you want to practice over there, especially in countries like the UK and the US, they need a dual degree for OMFS. They need you to be a medical medically trained OMFS surgeon. Like they want MBBS as well. So that will make it a little difficult. Your journey will become a little longer. So preferably not the US and the UK and sort of few more countries where they want the dual degree, but maybe Middle East, they need like one qualifying exam, like Dubai needs a DHA. So if you qualify that exam, then you can practice in the Middle East as well. And there are a lot of fellowship opportunities that you can do after OMFS abroad. There are fellowships which are 2 months, or like, even a longer fellowship if you can, directly get in touch with the director of the department. And if they're happy to welcome you into their unit for a while, for 3 months or 6 months, you can go and observe, or some places only allow observerships. Observership means you cannot put your hands into the patient, into the field, you cannot operate. But some people also allow you to assist. So that depends on different countries and different cities and their own rules or whatever. But to become a fully operating MaxFac surgeon, you will have to do a dual degree, especially in the US and the UK. Yeah, that's my answer. If Dr. Devyani wants to add anything.
You're absolutely right, Dr. Neha. I just know that one of my batchmate who was with me, the other female batchmate, so she actually went to the US, and she, like you said, she has to get into the dental school again, and she has to complete her DDS for her to be eligible to be practicing there. So since she got married and she went to the US, so after she has done her OMFS, she went there, and let me tell you, it's not an easy thing to get into those DDS colleges as well. She took a good 1 year because she would call me at nights and she would ask, how do we would discuss writing of the, performa and writing of the purpose. And also it does take a lot of effort. And she was just working as a dental hygienist, what you tell over there. Like, it's basically like your assistant. Okay, so if you're ready for that grind again, you are okay to go through that, then yes, abroad you have the opportunity, but you have to do DDS again, because your degree will only then be recognized in places like US and UK, as Dr. Neha has already mentioned.
Yes. So there is one question about for me. What I would suggest is you get in touch with the college, because I think they do have these certain rules where alternate years they accept students from All India Counseling or something. Since I had not applied for All India Counseling in the first place, I don't have much of an idea. I would suggest you get in touch directly with the college and ask them if they're taking All India quota seats this year, because some colleges have it only alternate years. Yeah, that's my answer.
Okay. Let's get back to another segment before we get back to the chat box. Okay.
Yeah.
So I think we were talking about females in oral surgery and content creation, and all of you found purpose in content creation. I'll ask you, Dr. Shiny, since you did it after your NEET PG, how has it been, and what drives you to create content on Instagram?
So I think for me, I've always wanted to start creating content right from, I think, third or fourth year of BDS, but something in me was like there is a personal barrier that I could not get out of and start creating. But I thought after NEET, MDS was done and we had a lot of free time, right? So finally, I thought, okay, why not give it a shot? And once I started creating content and putting myself out there, I really started enjoying the process of creating content, and especially connecting with different people through the process. So that felt very rewarding. And I think it felt like a mutually beneficial process where I was putting out content that people enjoyed, and I was also getting to know insights from different people's experiences. So yeah.
It's really nice. So guys, if you don't yet follow Dr. Shahini, I will put her Instagram link on the chat box. What about you, Dr. Devyani, Dr. Neha?
I think the same. It was a mutually beneficial thing for me as well, being on social media, because the more I started putting out content, the more I connected with different people from different areas, and how, people started sharing their journeys as well. And for humans, misery loves company. So people who are going through a similar journey, who are going through a similar grind, who are struggling, in your inbox, you get their messages, and then you rant about your faculty, you rant about your batchmates, and you also discuss a lot about your passion. In general, the passion for OMFS, you will encounter it on social media when you talk to other people and how they're approaching their cases, and then you decide to meet in a conference. Like you're in a different city and you made friends with them on social media, and your only way to meet is probably in a conference. So it's amazing the network you make through social media, especially in a niche field like maxillofacial surgery. I found some really good friends because of this content creation and everything. And yeah, you it also pushes you to become a better surgeon, to be very honest, because you cannot be speaking nonsense on the social media. People are going to call you out for it if you're going to just utter anything. So it pushes you to be a better doctor and a better
Okay.
physician. Yeah.
Yeah.
Absolutely right, Dr. Neha. Well, this thing, I think content creation was a different side of me completely, because I'm not, I felt like that is my rescue from the daily life, from the monotonous life. I was pregnant, I had my baby. So I was just into all these realms and sitting on the laptop whole day and studying books. So I wanted an escape, and content creation became that escape. And yes, so that was it. It's not always about, that you need too much of, what do you say, too much glorified cameras or backgrounds to, start creating content. Everything around you is a content. Whatever is happening with your life, you just put it, and, that's how people relate to you, like both of them said. I'm at a different aspect, creating other type of content. But yes, that's how I began my journey. And I just feel it's kind of my rescue when I just want to, go to that thing, get that. And that's like, I do it at night mostly when everyone is asleep. So that is me time. So that's the content creation for me.
Really nice. And I'd just like to add that, I have known everybody right here because of Instagram. So, Dr. Shiny, I just found you randomly on the feed and I was like, oh, interesting, different type of content. Randomly one day she was putting, I think, an alphabet series. That's when
Yeah.
I was like, okay, this is so interesting. That's such a different way of looking at dentistry. So your creative side, I feel, where there's something that you want to let out, probably cannot do it in college. I think this will be a great place to get it out. I'd also like to add some mirch masala here because this is the first time I'm revealing something on a public platform. But we're going to soon have meetup, a very grand meetup to celebrate dentists into content creation, into doing different things. And haven't announced it, but looking forward to meet all of you in person.
I'm
We're
so
excited already.
excited. When it is going
Yeah.
to be? Give us a little info just for the 20
The
of us.
dates, yeah, for the 20 of us, it's going to be in the next 2 months. It's going to be super grand. Like you
Where?
cannot even imagine. It's in
No,
Mumbai.
but I
So
need
Wow.
to tell because I am in Pune and I'm in my fellowship. How am I going to even make it?
I think we will make sure that we announce it in the coming week publicly. But looking forward to see all of you in person.
So excited. Yeah.
Yeah.
My only request is please do it on a weekend.
It's a
Yeah,
weekend.
please.
Yeah, it is definitely a weekend. That's the request we've got.
Sunday,
And
preferably.
probably a Sunday,
Yeah.
yes.
Yeah.
And you just have to make it like whatever happens, you have to make it.
Done. Looking forward to meeting everybody. It's really nice to connect this way in person also, not just
Yeah.
virtually.
Not just virtually, right?
Yeah.
Yeah.
Okay. So, yeah, we'll take the last question that's there on the chat box by Dr. Isha. Do you know of people who might have taken loans and are they able to repay it?
I don't think I know anybody who's taken a loan. But will they be able to repay it again?
Depends on them.
How much you put in. See, if you put in more hours of the day, right? you will be able to make the money. If you work only 3 hours, 4 hours a day, then it will take you a longer time. But if you're dedicating more number of hours in the day to your job, to your work, go to more clinics, take up more cases, then it will start happening sooner. I think it's a very basic understanding of earning money. Like put in more hours and yeah, it'll be sooner.
Got it.
Very
Yes. If you
directly,
guys have more questions,
sorry, I was saying it was just a very directly proportional kind of a thing. Yeah.
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 It totally depends on you. Like, I mean, if you will go through the YouTube page that we've had, I have seen BDS doctors do amazing. I've seen MDS doctors who are struggling. I've seen, I don't know, doctors who are not practicing dentistry also do amazing. So I feel it totally depends, non-clinical. So I think it totally depends on you always. That's like the bottom line of anything that we've discussed today. But yes, to get inspiration, to really understand and weigh the pros and cons, you must speak, you must attend sessions like this where we are openly discussing things. But at the end of the day, none of this will matter because your situation, your location, your personal life is very different in comparison to any other person you will ever be able to compare yourself to. So it's totally dependent on you again.
Yes.
All right.
Totally.
So, thank you so much, everybody who attended the session. I really hope it added some passion to what you want to be doing, or the opposite. Okay, so it might make you feel that no, this is not for me. But I think that's a very good indication if you're able to feel all of this right now rather than 3 years down the line. So, I feel if you are, considering oral surgery, follow the three people right here in front of you. They're going to inspire you not just today, but throughout your life, because this subject will be a very strong core part of you. And they are there to answer anytime, anywhere. Connect with them, and they're genuinely beautiful people who are here to help you without any of their gains. So, do follow them and make sure you like, share, subscribe to whatever they post. It really, really motivates whatever they're doing to make the content. Even if you write like a single comment when they post a reel, I think that adds way more value than you could ever imagine in their lives. So, thank you so much for attending the session, and I hope this helps. And looking forward to the next Sunday with another specialty and discussing what goes behind the scenes of becoming a postgraduate. Thank you so much.
All the best, guys.
All the best, everyone. Thank you so much for having me.
Thank you for
Yes,
having us.
thank you so much for having us, and good luck to everyone over there.
See you on Instagram.
Yes.
See you on it, and I hope we see all of these people becoming oral surgeons now.
Yeah. Okay. If am I audible?
Yes.
Yes.
If you decide to take up oral surgery and you have attended this session, then let us know once you get the branch.
Yes.
That one
Yes,
visit.
definitely.
Please, we would love to know, which college and where you
Yeah.
get
Just
into.
drop us a
So,
message, please. We'll be so happy to know that we were even a small
A small part of it.
your
Yeah,
journey.
yeah. It really, like, sitting here on a Sunday and giving this kind of time, the actual passion, okay? I feel if you just send us back a message that I am so and so, it helped me actually figure out that this is my passion. I think that will go a long, long way. So thank you so much.
Definitely.
And yeah,
Yeah, see you on media.
bye.
okay, great.
Bye,
Bye
guys.
bye.
Thank you so
Thank
much.
you, Palak. Thank you, Devyani. Thank you, Shahini.
Thank you all. Thank you.
Thank you. Thank you. Bye bye.
Yes. Bye.